Okay, there's always a lot of questions. The first two questions are, my child needs medication, and or statements. My child should take the following over-the-counter medicines. So those forms, those questions or statements specifically tell you which form to fill out. Those forms are online. They're also at the doctor's offices. Now, for outdoor ed only, the over-the-counter medications do not need a doctor's signature. That is like delightful news, okay? So if it's a prescription medicine, it will need a medication form, which is this form. But if it is a over-the-counter medicine, you will still need the form, but the physician doesn't need to sign it. I have the sheet I gave you, the blue sheet, is a very well laid out, hopefully to you, as it was to me, form that explains the process. The next two statements talk about allergies and anaphylaxis. Certainly write it on there. I know just about everybody who has an allergic reaction that's of an anaphylactic nature in 6th grade here at Ridgeview. I believe I have almost everybody. But if there's someone who hasn't told us about their student having an anaphylaxis, this is where we would like to know. It's very important for outdoor ed. And in general, of course, but certainly for this program, we do need to know that. If they have an allergic reaction, you can state this on here, and certainly there's another reference to the form there. So also there's an other information section on the left side of the form. This is important information about how to reach you. This is where we return it outdoor ed to reach you all. So please fill that little piece out for us. Sometimes it's left blank. So I want to address that. Now, I want you to remember that there's only 3 days that these kids are going to be at a time. You know, there's 2 sessions, but 3 days is the only amount of time the kids are going to be there. So you don't need many meds, okay? I don't want to encourage you necessarily to send meds, but I want you to know that we are happy to take those if you feel they're needed. There are no standing orders for medications at outdoor ed. So in other words, there's nothing in stock that we just medicate the children with as part of the program. That's not available. So if you feel your child might have a headache or might have an allergic reaction, and you want them to have a medication for that available, you need to supply it. That's the point. This is the form. So for outdoor ed only, you would fill out parts 1 and 2 for over-the-counter medication. So that's anything from vitamins to cough drops to Tylenol, Advil, allergy medicine, anything over the counter, parts 1 and 2. If it's a prescription medication, the physician has to fill out part 2. The parent fills out part 1, okay? And this form again is available online on the MCPS website, or you can certainly call your doctor because they'll need to fill it out and say, I need a medication form filled out for my daughter to have her prescription medicine. A lot of the kids have the ADHD medications and also sleeping medications, some of them have. So they typically do need a medication form filled out by the physician if it's prescription, okay? The label on the bottle, this is really important. The label on the bottle must match exactly what is written here by the physician. So if the doctor writes 2 puffs every 4 hours for the inhaler, the container must read 2 puffs every 4 hours. Okay, it cannot read 1 puff every 6 hours, and this says 2 puffs every 4. We won't accept it. There's too much confusion. I'm sure you understand what I mean. Okay, and the effective dates are just the dates your child is at outdoor ed, unless you want it to stay in the health room. Okay, and then it can be filled out for the remainder of the year. It's absolutely fine with us. If not, just the outdoor ed dates. Okay? Yes?
So if you already have a form on file on medication in the nurse's office, is that something that will travel with the child, or do we have to do this in addition to what's already on file?
No, that's a great question. I was going to get to that too. If they have an EpiPen or an inhaler in the health room already, those are sent automatically to outdoor ed. But if it's a over-the-counter medication that you would like for them to have available, you need to let us know. You need to give us a call, and then we will take care of it. If it's available in the health room now, you see what I'm saying? Some girls have, medication for their cycle. So that medication can go with them if we are informed. But that's not a prescription med, so we don't automatically send it. Okay, that's pretty well outlined, I believe, in there. The containers that come in must be unopened. They cannot be opened bottles of Tylenol. Can't accept it. Has to be sealed from the store. It can be a travel size, so you don't have to buy like a whole container of, don't send in anything from Costco, please. Because, it's too much medicine for 3 days, okay? Also, no additional drugs are to be included in their suitcases. I know it's tempting. There's a certain amount of work involved. Can't do it. We go through the suitcases. We make sure there's no meds in there, no drugs, because of obvious reasons. And also the kids, some of the students will have an allergic reaction, and we have to protect those children. We can't have the kids in the sleeping bags or on the cots, giving out medications or anything like that for what they would consider a real reason. But we can't have that to happen, okay? So we would either call you up and ask you to pick those up and transport them yourself to the Smith Center for your student. They have a medical office too there, or we would throw them away. So we are happy to work with you. So just let us know what works for you, okay? Question?
If someone is self-carrying their inhaler, will a counselor or an adult always be with them? Because what if they don't have a pocket? I know that sounds
Yeah,
silly.
no, that's a very good question, and it is addressed, I believe, in your packet. The kids who have inhalers that they're going to self-carry or EpiPens will carry a backpack that's provided by the outdoor ed medical office there that's of a certain color, like it's a bright green, so everybody who works outdoor ed knows that there's medication in this bright green backpack. It's put in the backpack, the child self-carries it all day in the backpack. And if they need it, they can then use it. At the end of the day, they're turned into the office, and then in the morning, the office brings them back to the children. So they have it available to them, okay? Was there another question? Sorry. I see another
Also, if I might cut in, it's a pretty cool looking backpack, and a lot of kids have it, so it's not like they feel like, weird having the backpack. I mean, that's the first thing that the kids think about is like, but it is a cool looking backpack. It's like a string bag. It's not like it's cool.
Yeah, exactly.
I think it's cool.
So, let's see. So, the last day for medications to be submitted is December 7th. We'd like to have them by the 4th, which is a Friday, but we're giving you till Monday the 7th. After Monday, we will accept nothing.
So we send it to the
We send it to the school, to the health room where Mrs. Thomas is. You might have met Mrs. Thomas already, or myself. I'll be there as well, not every day, but I'm there a lot. So send those medications to the health room here. There's a big process. We have to fill out a card, and we have to count them, and it's a big deal. So that's why we have to have that amount of time prior to them leaving in order to get that all done correctly. We log it. It's a big deal, okay?
That's for over the counter as well.
That's for everything, right. No, these are good questions. I appreciate the questions.
As far as the bandages or anything like that, let's say if somebody gets hurt or...
Oh, sure. Sure, so they have a health room at Smith Center, just like our health room here at Ridgeview, just like it, with all the supplies that they would need, ice packs, bandaging, tape, green soap, but nothing else. There's no ointments, they have Vaseline, that's all, calamine, but that's all. There's nothing else provided, just like regular school, okay? Did I say that the deadline is December 7th? Did I say that? Okay, just wanted to make sure.
Okay, so you prepare for it.
History teacher, I'm sorry, it's Pearl Harbor Day. Yeah.
Oh, it is Pearl Harbor,
Yes, it
Pearl
is.
Harbor Day, yes. So obviously you don't want to bring anything the morning of. Can't do it. Okay, we have a lot going on. So I work with the students myself who are self-caring and make sure that they understand the rules around self-caring. We don't share it, this is for you alone, how to carry it, etc. Whether it be an EpiPen or an inhaler, and they will carry those in, like Mr. Doggett explained. Any other questions? Okay, well, we're available, just give us a call, email us, and we're happy to help. Okay?